Welcome to another exciting episode of American Warrior Radio, coming to you since 2009. If you or someone you know has ever worn the uniform of the Army, Navy, Air Force, Marines, Coast Guard, Space Force, or National Guard or Reserves, you've come to the right place, American Warrior Radio. We're always efforting to bring you news, notes, interviews, and current events for all things military and veteran related. The bumper music for American Warrior Radio is provided by none other than combat veteran and mill hop artist Stephen Hobbs. Thank you, Stephen. With that said, let's kick the tires and light the fires and get this episode off the ground. I want to remind you that AVET Project must raise funds for our PR&R retreats for active duty and veterans. PR&R, Project Recuperation and Reintegration Retreats. It changes lives. Help us help them, and help yourself to a chance at winning this Kel-Tec KSG 410 shotgun. You've seen Kel-Tec in the movies, John Wick, Hawaii Five-0, all over. Go to the website, avet-project.org. Drawing is to be held on Patriot Day 2024. That's 9/11/2024. Until next time, don't forget, thank a vet. It's Garen Cohn with another exciting episode of American Warrior Radio Show. We've got a very special guest. I've come to know this man through a friend of ours, Leah Buchholz with Prestige Veterans. And I believe they serve together, they work together, they consult with one another. It's none other than Doc Askins. Your first name is Ben, but you like to be called Doc, right?
That's true. Yeah, all my favorite people call me Doc.
Well, I want to be one of those people. Let me just read a little bio, because this man, I could go on for half an hour on all his bona fides. He has a degree in outdoor education, intercultural studies, physician assistant studies, and divinity. He has 2 decades of experience practicing and teaching wilderness, tactical, and expeditionary medicine in the military. In civilian life, he's a psychiatric physician assistant with an integrative approach to mental health and extensive experience in providing psychedelic-assisted therapy. There's a little hint there, what we're going to talk about. Psychedelic-assisted therapy and precision medicine. He's certified with Multidisciplinary Association on Psychedelic Studies in MDMA-assisted therapy. Doc is a National Outdoor Leadership School alum and has postgraduate training in Neuropsychiatry and Genomics. Welcome, Doc. Thanks for joining us.
Well, you are a gracious host, and boy, that was a really nice bio. It's almost like I wrote that myself or something.
There's other pages of it. I tried to encapsulate it. Okay, before folks got a little sense of what you've done, but give us a little more on that bio subject. Tell us what got you interested in the military and where you stand with that service now.
Yeah, my dad served in Vietnam. Both my grandfathers served in World War II. It was just kind of a tradition of service that they never pushed on me or never suggested, but it just seemed like that was something that was formative, that made them the men that they were. And I looked up to them and they were my heroes. So it just made sense to me to follow in their footsteps to some degree. So from a pretty young age, I wanted to serve, but that route to service for me was weird and unusual. I tried to enlist as a PJ at age 17 in high school, but found out that I was colorblind. So I was genetically disqualified from trying to get into any of the, tip of the spear, special forces, tabs and badges stuff. And since I couldn't do the job I wanted, I tried to kind of cobble together a civilian version of that by getting that degree in outdoor education and intercultural studies. And I taught wilderness emergency medicine all over the planet as a civilian before I ever joined. About 10 years later, realized if it wasn't going to happen then, I was going to have to do it now. So at about 27, I enlisted into the military. I already had a bachelor's degree.
Cutoff there.
Yeah, I was like slid in under the wire. I enlisted when I was 26 and was turned 27 when I was in basic training as a combat medic, 68 whiskey, in the National Guard. Couldn't talk my wife into the regular Army thing at that point, but she bought the lie that the recruiter sold both of us about 1 weekend a month, 2 weeks in the summer sort of stuff. And yeah, spent 10 years as a combat medic before doing an okay enough job to get selected to go to the Inter-Service Physician Assistant program, or IPAP, which is maybe the best deal in the universe for getting a career, honestly. Like, they paid me staff sergeant pay to go get a graduate degree as a physician assistant. So if you're a young medic or corpsman, or I don't know what they call medical folks in the Space Force now or whatever, like a Medanot or whatever they do. If you haven't heard of IPAP, you need to do your homework and look into that, because it is an outstanding program and an excellent career opportunity for somebody.
Indian Papa Alpha Papa, is that what you're saying? IPAP?
That's correct. Yeah, IPAP, Inter-Service Physician Assistant Program. The first phase is 16 months at Joint Base San Antonio, Fort Sam, Houston, and then the second phase depends on which branch you're in and where you get sent. I went to Fort Campbell and Blanchfield Army Community Hospital because I'm in the Kentucky Army National Guard, and that was the closest to my home state, right there on the Kentucky-Tennessee border. And it is a beatdown academically. It's like getting jumped into a gang. It's just tests are on Monday and Friday, and here's a million slides and books. Good luck. And if you survive the first phase, you get some amazing opportunities to see a lot of different medical pathology in a military community hospital, right? So it was an excellent opportunity for me. I was a bit of a late bloomer. Like I said, I went through and enlisted at 27, even though I had a bachelor's degree at the time. I just didn't really want to be an officer. I won't go down that rabbit hole, but they convinced me to do it by going to PA school, and I did that at 37. So a little bit late to the game, but I'm doing my best to try to make up for lost time.
And obviously, this is a career path that you would recommend for those that are in some sort of military medical profession right now that have the desire and the drive, because you mentioned the IPAP itself is pretty concentrated study.
Absolutely. It's if you get through in the initial timeline and don't get recycled, it's a 26-month skull drag through.
Wow.
It's a lot of school. You get a bachelor's degree in 16 months and you get a master's degree in 13 months at the end of the thing. And it's basically like 4 to 6 years of college in 2 years time.
Yeah. So you worked it hard, and then you went into that profession within the military. And take us along that path a little further.
Yeah, I had planned to go into emergency medicine because I'm a bit of an adrenaline junkie, as you might have picked up from the bio there with the, outdoor adventure sorts of stuff. But I lost a friend during phase 2 to suicide. He was an Afghan vet. He'd been the executive officer of one of the units that I was in, and he was just a really good guy. I couldn't even believe that he went out that way. And the very next day, I was doing my emergency medicine rotation, working a 13-hour shift in the ER at Bach, and an intentional overdose came in via ambulance, and just being confronted with a suicide right after losing my friend. I knew what to do medically. We intubated her, stabilized her, got her into the ICU, but the prognosis isn't really good, either medically or psychologically, after you've kind of taken everything in the medicine cabinet, right? How long, how much damage did you do to internal organs? How long were you not breathing for? And then the likelihood of repeat attempts after that initial attempt is statistically much higher. And, because I had the Master of Divinity degree already that I used the GI Bill to get along the way, I convinced the chief of the ER to let me go with the chaplain and sit with the family after we stabilized the wife, and then the husband was a soldier.
You're still dealing with you're freshly dealing with your friend's suicide.
Exactly. Yeah. The day before I got the news, and then I went in there and, looked at this guy, and I might as well have been looking in the mirror. Like, he could have been me. His daughter was with him. His daughter was my daughter's age. My heart just broke, and I decided, sometimes you find your calling. I found mine real late in life. I was kind of a lost soul, just trekking around looking for adventures, but that it broke my heart. And I said, I don't know anything about this really, but I want to do something about it. And I've just been kind of stumbling headlong into trying to figure out how to address mental health stuff rather than emergency medicine stuff. And had a friend who hired me straight out of school into psychiatry, which is rare as a physician assistant to get the opportunity to work in a specialty. And he was just a cutting edge physician here in Louisville, Kentucky, Dr. Robert Stewart, who was doing ketamine-assisted therapy outpatient in his own private practice. And I kind of got to cut my teeth there doing that. In 2020, I got my medical license in February 2020, and in March of 2020, I'm sure you remember, the whole world shut down because of COVID. And a whole lot of the patients that you would normally want to manage by putting them into an inpatient setting, we didn't want to send to a hospital. So I wound up doing a lot of treatment-resistant depression, complex PTSD, and acute suicidal intervention therapy with ketamine-assisted therapy in an outpatient setting, just because we didn't want to put these people in the hospital, which was about as intense as it could get, right? It was kind of a baptism by fire. I was very fortunate to have him, showing me the ropes along the way, but got pretty good at talking to people who are at the end of their rope and kind of figuring out ways to talk them into wanting to stick around a little bit longer, or at least give
Exactly.
it a
So,
second
Doc,
chance.
how are you today in coping with this dear friend of yours passing?
Yeah, I mean, I still wear a memorial bracelet. We have those, veteran memorial bracelets. It's got my friend's name on it. I remember him absolutely every day. It's that war at home, right? Like I volunteered to go to Iraq one time. I was one of the last soldiers out of Iraq in 2011. At the end there, it wasn't like a real kinetic deployment or anything by any stretch of the imagination, right?
Still had
But
a target on your back.
yeah, it wasn't fun, but well, the gym was fun and my friends were fun, but it's that mixed bag, right? But I volunteered to go on that trip and we didn't lose anybody from, my unit along the way, but we started losing people at home, losing people to drunk driving accidents, losing people to suicide, losing people to, accidents and to terrible sorts of things. And I feel like maybe my place where I fit a bit better is trying to combat the war here at home for veterans after deployment, maybe more so, especially now that I'm getting a bit older and slowing down a half a step or whatever. I really just want to pitch in on helping people to become not just undepressed, but fully engaged in their lives over and over again. I don't know why it hasn't caught on more broadly that, psychedelic assisted therapy in general, because of legality, hasn't caught on. But ketamine assisted therapy, because it's an off-label treatment, also has been.
You're talking a lot of stuff, our viewers. You're going right over.
Oh, okay. Going over their heads.
We're talking to Dr. Ben Askins. He is very proficient in all sorts of disciplines, but specifically, and this is where you're leading this conversation, dealing with this crisis we have in the country. At the end of every episode, our producer, John, has recorded this wonderful announcement, a PSA about suicide prevention.
Oh, wow. Yeah.
Yeah. So everybody, as you watch the episodes, you're subscribed to the channel, I know. So you'll see. Well, Doc Askins is basically, you're on a mission to see how you can get plugged in and get the stigma of the treatment for specific types of treatment, and we're going to talk about those, into more like the mainstream.
Absolutely.
Is that kind of where we're at right now?
Absolutely. Yeah. So at this point, you mentioned that I have a certificate from the Multidisciplinary Association for Psychedelic Studies, or MAPS, in what's called MDMA-assisted therapy for
We've all heard
post-traumatic stress
those
disorder,
letters,
right?
MDMA.
Yeah, that's been in the news enough that I think most vets at least are curious about it. And plenty of people have experimented with,
what is it? I know what it is, but tell us.
The molecule itself is 3,4-methylene dioxymethamphetamine, or MDMA, right? And that is a party drug of abuse in some settings, or called Molly, or ecstasy, or Atom, or there's a whole bunch of names for it, right? And
I didn't know that. So MDMA carries all those names, Molly, ecstasy, it's all the same drug?
Yeah, and it, the action in the brain is complicated, and I don't necessarily have to go into the science or anything of it right now, but for the most part,
over my head anyway.
What MDMA-assisted therapy does in PTSD is it essentially turns down fear and turns up love and connection in the brain, which allows therapy to help people who have traumatic memories that are triggering, that are wired in tight and associated with fear and anxiety and hyperarousal and all of the constellation of symptoms that we call PTSD at this particular time. It allows somebody to revisit those memories from a place of compassion and courage and strength, rather than a place of overwhelm and fear and anger and shame and some of those sorts of things. Whatever that might be.
You apply this MDMA in a clinical setting, or at least closely monitored for the patient, and you're turning down the fear and you're turning up the love. That sounds interesting. This drug can do that, as long as it's, facilitated by somebody like yourself.
Yeah, it's super interesting, neurobiologically, but then the therapy itself, here, I'll relay a story that maybe is the way that'll get this across most clearly. The first video that we watched, so they run these clinical trials where they give MDMA with two therapists sitting with a person. It's an 8-hour journey, like the medicine's in your system and you're having this altered state of consciousness. We call it a non-ordinary state of consciousness. where somebody's wearing an eye mask, listening to music, and two therapists are sitting with them for a 6 to 8 hour session. And they're going, we call it going in. They're going into their memory and they're going back to the worst day of their lives, usually. And oftentimes you don't even necessarily have a choice, but that's some of the intention that gets set. And you go back to this sort of index trauma, whatever that might have been. It might be childhood trauma. It might be war trauma, whatever it is for you in particular. Chances are pretty good you're going to be right back in that situation. The first video they showed us was of a combat medic in Iraq, which, that immediately caught my attention, right?
That was you.
He was in the clinical trials, and they showed us the video partly because he was silent the whole day. He had 8 hours where he was just quiet, wore an eye mask, listened to music, and had the experience that he had. And then he wrote a letter to his therapist afterward. And there's integration therapy sessions. They have 3 sessions in prep for that medicine day and 3 integration therapy sessions of 60 to 90 minutes after that. And they do 3 medicine sessions. So it winds up being 40 plus hours of therapy.
Wow.
Plus 3 sessions in place, right? It takes 2 or 3 months on the calendar to go through a course of MDMA-assisted therapy. That being said, his experience that first time was he was right back in Iraq, where his team leader had been hit by indirect fire right in front of him and had died. And he had had some childhood sexual trauma where he had a freeze response. There's, you get adrenaline shooting through you, and we call it fight or flight, but freeze is also a common thing. Freeze, fight, flight is what we ought to call it. And he froze up when he was a kid, when he was abused, which is something that's natural for a nervous system to do, right? And then when he was watching his friend die in front of him, he froze all over again. He had the exact same feeling that he had when he was a kid, and for decades blamed himself for his friend dying. I'm a medic.
I was going to say that
I'm supposed to be taking care of my friend. My leader is dying right in front of me. I froze. I didn't do my job, and I hate myself. The trauma from the re-traumatization of watching that after the childhood that he endured, made it difficult for him to even function in society, right? He was back in.
He was shoveling more
Exactly.
onto the fire of the psychiatric issues.
It's just trauma stacked on trauma for him that he's just carrying around, right? Like there's great books like The Body Keeps the Score about the way that we carry memory and the way that influences who we are in the world.
And he
was right back in that.
Reading. I saw that about you too. What was that last book you mentioned?
The Body Keeps the Score by Bessel van der Kolk. It's a bestseller. It's pretty famous for a lot of non-traditional approaches to trauma therapies. So he's right back in Iraq in his memory, watching his friend die. His friend dies right in front of him again. And then his friend gets up off the ground, healed and whole, and walks over to him and says, "Hey, I know why you froze. I understand that it wasn't your fault. You are not to blame for what happened to me. I would have died of these injuries whether you had done something or had not done something, and everything is okay. I love you. I forgive you. And you're a good man and a good friend to me." And I'm getting like a little choked up just even trying to relay it, right? I can imagine the level of healing that someone experiences going back to just the worst day of their life and seeing that their friend is okay. And it kind of rewires your memories in some ways, right? Like he knows that isn't what happened, but he's able to forgive himself. And now he's able to orient himself in the world from a place where he doesn't carry that memory as if it's quite so heavy anymore. Everybody,
what... Let me get you to pause there for a second. We're talking with Ben, otherwise known as Doc Askins. He's getting deep into this stuff quick, but he has a natural ability to do this, and he can, get right into the heart of the matter, which I want to pause right now because we're going to continue this on the other side on American Warrior Radio Show. Don't forget, thank a vet. Hi everyone, it's Garen Cohn with American Warrior Radio. I'm here with my good friend Christian. We're here to deliver a very important message about a crisis in our land.
Suicide prevention, more specifically, veteran suicide prevention.
22 a day are taking their own lives. This must stop. This can't continue. If you or someone you know is contemplating suicide, please know that God has tomorrow planned for you. Don't take your own life, and just remember, suicide is a permanent solution
to a temporary problem.